Okay, well, welcome everyone. Welcome back to the Health Made Simple show. Love having you here. Keep doing your thing, keep sharing it out, keep spreading the love. Tonight, we're going to hopefully simplify how we go about and help pain modulation. Really meaning, how do we help manage pain in life? If you've been fortunate enough to not have much physical or emotional pain in your life, awesome. And I'm certainly not going to be the bearer of bad news. Yet there's a good likelihood, a strong likelihood that at some point you're going to experience some. And tonight, hopefully, we'll prep you with ideas and concepts and literally actions that you can take to help modulate it. So I've had the fortunate opportunity for the last 27 years of my life to work directly with people in pain. And I've seen it all. I've seen some of the kindest people I know turn into what you would think is an evil-headed monster. And pain can do that to us. So I also have the luxury of understanding that when we're in pain, we're not usually emotionally the best versions of ourselves. And that is why a show like this tonight, with having a kind of already a plan in place that we might be able to utilize when that moment happens. Because when the moment happens and we don't have any type of strategies or plan or backup system in place, then often we can make some poor decisions that often backfire on us. And we see a lot of that with pain management in our country. It's become a massive, massive, massive issue with addictions to different drugs and making things even worse, and unnecessary surgeries and unsuccessful surgeries, because oftentimes we're making decisions at our worst, in our worst environment when we're in pain. And we're not necessarily thinking about how do I change my lifestyle. We're often thinking about how quickly can I get rid of this thing that's really bothering me.
It's so understandable, Bart, truly. And I think all of us listening tonight know that it's we don't necessarily make our best decisions in those moments in the acute pain. So a great reason to tackle it tonight. Before we dive into that topic, Bart, do you have any clinical insights for us?
I do. I have two that I'm looking forward to sharing, both of these totally different ones. For the first one is, it really is just something I want to share because it keeps coming up in just weird little strange messages for me. And it's really to remind all of our listeners a little bit about the importance of minerals. And I'm going to elaborate on that just a little bit. So we often talk about nutrition. We often talk about different supplementation and whatnot, and how important vitamins and all these different nutrients are. But quite frankly, everything starts with our minerals. And this is a kind of a big problem in our country and the worldwide, for that matter. And what I mean by this, so minerals come from soils. So yes, you can get them from plants, but before the plants have them, they have to get them from the soil. And animal food has them, but in order for the animals to get them, they got to get them from the plants they eat, and they also have to get them from the soil as well. So really, it is our soil that becomes critically important when it comes to feeding human beings. And when I talk about minerals, a lot of people might think, well, what do minerals actually do? Well, minerals make us strong bones and strong teeth. They balance the body fluids in our body, and they're what convert food into a usable energy in the human body. The reason I'm bringing this up is for a couple of reasons. One, we have a challenge ahead of us when it comes to the farming practices in our country. So a lot of the topsoil. So think of the topsoil when you go out and you go into your yard and you think, how deep is the topsoil? And I can tell you right here where I live here in Florida, and I don't use any pesticides or herbicides in my property, my topsoil is less than a quarter inch deep. So basically, it's the grass that they planted. They came in big rolls and they unroll the grass. That's my topsoil. Underneath that is sand. So we're really not extra. There's no good soil here. And I could go up and down 20, 50 mile stretch and barely find any soil. Really different when I get up to my farm. But right here, that's a true thing. Throughout our country, so for many of you, listen, if you're local, you go outside, stick a shovel in the ground, and you're going to hit sand real fast. And so therefore, there's really no minerals there. That's just sand. There's no sand on the beach there. I'm sorry, there's no minerals coming off our beach from the sand itself. So the challenge that we have in our country is that most of our farms, especially commercial farms, their topsoil at best, at being very generous, is 1 to 3 inches. And what happens there is the more we keep over farming and we grow corn on top of corn on top of corn on top of corn, it just keeps pulling these nutrients, these minerals up into the corn stalk, and then we go off or eat it, or cows eat it or whatnot. And we end up depleting our soils. So we're literally stripping, we're raping our earth of all these minerals because we don't have this regenerative system in place. So we've talked a little bit here. I was fortunate to have Will Harris on our podcast one day. And if you haven't checked that podcast out, go back and listen to it. So especially if this topic rings a bell at all for you, you want to go a little deeper. Will has a regenerative farm up in Bluffton, Georgia. I believe that's where it is. And where they regenerate the earth. And so it's this big, dynamic, complex situation that refeeds itself. Instead of just taking from, it gives back as well. The other reason I'm bringing this up is this. So I had a conversation about supplements today, and someone asked me, said, Doc, it seems like you are pretty all into this supplement company called Standard Process. And I don't really have a bias other than if there's an awesome one out there, most likely that's what I'm going to use for myself, my family, my dogs, and my clients. And so one of the reasons, and I'm bringing up this whole mineral, this is a long story here, but I am such a fan favorite of what Standard Process does, is that they have some of the best topsoil, if not the single best area of topsoil in our country, maybe the world. Some of their topsoil up there is about 8 feet deep. And I didn't know that originally, but I was listening to years ago, I was listening to this doctor, many of you know him, his name is Dr. Zach Bush. Zach Bush is a medical doctor, also a scientist, and he's brought some incredible new concepts and ideas about sustainability and health to the forefront, especially in the functional medicine world. And one of the things he always goes back and emphasizes is the importance of minerals. And he was the first one that kind of opened my eyes to the fact that these farms up in Wisconsin that they have topsoil that are 6, 8, 9 feet deep, which is unheard of. Nobody else has them. So
but you're saying 9 feet, not 9 inches. Like
no, 9 feet. Yes.
Deep. Cool.
You know, and what's fascinating about this, so I'm not a soil guy. I don't know those types of things. In order to get a topsoil that's that deep, it takes millions of years, millions. So it's one of the reasons I'm such an advocate of, if I were going to use supplements and we're going to use whole food supplementation, let's use it where it's coming from the absolute best soils in the world. So that's just a little clinical insight. If you're ever wondering if there's an important to minerals, yes, we talk, this is the perfect time of the year. Everyone's talking about the heat and using electrolytes, sodium, potassium, chloride, all those fun guys, right? Magnesium, where they come from? The earth. They're coming from the soils originally. All right, so that's my clinical insight number one. Hopefully that shares some value for everyone, or it at least makes us start to think about maybe even where our purchases are. When you're able to put your money in front of a regenerative farmer and speak that way, everybody wins. The earth wins, you win, you get better food, better nutrition for you. The farmer wins, and again, the earth wins. So let's do whatever we can. Every dollar does count.
And if that lights anybody up, friends, I've also just linked that Will Harris podcast that Bart did not too long ago. It's so cool. If you have any interest in regenerative farming, like those topics, it'll get you jazzed. So we've got that in the show notes.
Okay, so the second one, completely different, and I wanted to share something about. So recently I ran some labs with a young lady, and her cholesterol panel was super high. Uncharacteristically high, especially with all the work that she'd been doing over the last 18 months. I forget the actual numbers, but way high, like total cholesterol is around just under 300, which I guess you can consider high. Anyways, the reason I'm bringing this up is, so when we look at labs and we do any of that stuff, it is there for us, especially as a practitioner, especially if you're seeing a functional medicine doctor. Here's how incredibly important it is to do that. If you're going to take labs, please go to a functional medicine doctor, and how we might approach something. So of course, the client looks at this and has a little bit of a panic, and they're bringing me this lab work through their traditional medical doctor with enough wherewithal to pump the brakes and say, okay, let me just run this by Dr. Bart. Let me just see his input on this. And not that I'm any smart or anything, but maybe there's just an approach. So when I saw the labs and she's like, oh my God, how could this happen? I'm doing this and I'm doing this. And I then started asking questions. And this is trying to get to the root cause. This will feed right into tonight's conversation as well. We always have to get to the root cause instead of looking at something and by itself calling it bad. Maybe it's there for a good reason. And maybe you actually needed that thing. Maybe it's the high cholesterol. Maybe it's the pain in the moment. Maybe you needed it to help protect your body. So in this particular moment, we said, all right, I started asking questions. Okay. All right. What are some of the other things outside of diet? Because I know her diet was pretty damn clean. Outside of diet, what are some other things that could really negatively affect a cholesterol panel? And this is the part I wanted to share with everyone. So there are a couple very, very important things that can really manipulate your scores, or let's say your result on a cholesterol panel, especially if these things happen the day before. If you had a really bad sleep the night before and your body stayed inflamed, because remember, we heal when we sleep. So in the event you had a really short sleep, you only got 4 or 5 hours in, and she wasn't sure. Fortunately, she has an Oura ring. So literally in our conversation, I said, let's go back to the date. And I have the labs in front of me. We said, all right, we pulled the labs here. Let's see your sleep schedule over those last several days. And over in those like 4 days leading up, there might've been like 15, 17 hours in 4 days.
Wow.
Super high stress. And I don't know that this is like, it happens, right? There's sometimes you go on a string, maybe you only get 5 hours a night for a couple nights for whatever reason, super stressed and still working out real hard. So now if you worked out really hard the night before you draw labs in the morning, say, especially for cholesterol, you absolutely could have higher LDLs because it's an inflammatory state. So now we have 2 strikes. We have no sleep, and then we have higher, lots of tissue breakdown. And then third is stress. And cholesterols are designed to help your body manage inflammation, so to help manage damage that's taking place in the body. So in this scenario, we pumped the brakes and all right, you had all 3 strikes here. There's a high possibility that literally what happened that week drove those labs up. So let's slow down a little bit. Let's make some modifications. Let's stick to this. We won't retest for about 60 or 90 days. And hopefully I'll get an opportunity to report back. But that is what I talk about, pumping the brakes and having in place either an accountability partner. In this scenario, that was me. That was her doctor, or functional medicine doctor, or someone else that can say, all right, let's pump the brakes. Let's not get too out of control about a particular lab, a diagnosis, a label, or even pain for that matter. Let's be mindful about the actions we're going to take. And hopefully we have some type of safety plan in place that in the event I panic, you panic, someone else is going to kind of hold us a little bit accountable and say, all right, slow down. Let's back up, take a breath, and take a look at the situation.
Bart, we just have a clarifying question coming in. Does functional medicine blood work produce different outcomes than one a medical doctor would order?
No, not different outcomes. Most likely what you'll see is that they're much more in depth. So for example, when I run my labs for cardiovascular an evaluation, we'll run all your normal cholesterol panel, yet that quite frankly never tells your cardiovascular risk. And that's really what we want to know. Being that heart disease is the leading cause of death in our country, not bad to do a cardiovascular risk assessment, which means that we're going to look at particle size. We're going to look at insulin resistance. We're going to look at the inflammatory markers, C-reactive protein. So not a different outcomes, but we are looking at more of an elaborate testing.
Beautiful, Bart. Thank you so much. Okay, amazing. Shall we step into this pain topic for tonight, Bart? What is it? What is pain? What are we talking about tonight?
Yeah, so let's start off. Just hang with me as I have this conversation, and especially if you're not in a lot of pain right now, you can at least let it into the noggin, and then we'll kind of regurgitate and balance this out a little bit. So I'll start off by saying this: is that pain is not the problem. Pain is the symptom of some other problem that took place or is taking place. Our country, we got an issue with this. So I'll even back up another step. So about 80% of Americans will deal with some type of significant spinal pain through the course of their life. I'd probably say it's even higher than that. I don't think there's, I don't think 20% aren't dealing with it, and especially the more and more that our lifestyles are doing exactly this. We're sitting more and more, becoming less and less mobile, more stationary. We become more spinal pain we're going to have. So 80% of the country is going to have spinal pain at some point, significant spinal pain in their life. And I would say 95 or more percent are going to have some type of joint and or spinal pain, knee, wrist, elbow, shoulder, whatever it may be. So now we're talking about not just the majority, but almost everybody is going to deal with some pain. And quite frankly, our pain management system has been in a lot of trouble. They've literally been sued, the opioid companies, all that stuff, which I don't care to go there tonight, but nonetheless, the system itself for managing pain isn't an awesome system. And I recognize, because the reason I am a chiropractor is because I was in life-changing pain. I was 19 years old. I had an injury to my spine, my lower back. So here we are, 19 years old, had a spinal injury. And I had this type of pain that I've never experienced before. I was a rugby player. I've dealt with a lot of pain, but I had pain that was second to none that I'd ever experienced in my life. And it actually has given me a lot of compassion to understand where people are. And also what I recognize more than anything, looking back at that time, Whitney, how life-altering it was and how it affected my life. It took away my ability to play rugby, which was my pride and joy as captain of my team. It was part of my identity at the time. It took away my ability to just feel like a confident, strong young man. So that pain took away a lot of my life. And for a lot of people that are in pain, I hear you and I understand you, and that you want to do whatever it takes to get out of pain. And that's why I'm doing the show again tonight. We've done some other things on pain. I want to give you a whole bucket full of things you can do and know also how to hear it coming. That's a big part of it. We'll call two different situations for pain. One, there's a trauma. And folks, when I'm not talking about like you bent over the wrong way and your back blew out, that's not a trauma. That's a chronic situation that you didn't hear. It was on its way. You just didn't, you thought that it happened in a moment. It didn't. That was the tip of the iceberg. But there's trauma. You get in a car accident. For me, mine started with a trauma. It ended up chronic because I didn't take care of myself. Meaning I didn't gain flexibility back. I just remained out of pain. And that's a big difference versus getting healthy and strong again. So think of there's trauma, and then there's all of these lifestyle contributing chronic issues that most people are experiencing and contributing to every single day. And so that's why I know a lot of people are going to experience some type of pain because I look at their lifestyles. Sitting is like the new smoking. It might be worse because it affects the neurology. So it's so impactful on the neurology of the body. Smoking, at least it's just, for the most part, sticks to your lungs and your cardiovascular system. But sitting all day long changes literally the way that your nervous system works.
So you mentioned, Bart, spinal pain and maybe like various joint pains. Is there another place in the body that pain can come from?
Yes. So, I'm going to say yes. Yeah. So we can have pain. So all pain, I don't know if this is really what you're asking, but I'm going to go here. All pain happens in the brain. That does not mean, Whitney, that we're making it up. That is not what I'm talking about. Okay. We certainly can manifest, and I'm going to get this into the different, there's ways to modulate pain in our thoughts and our how we think is a huge part of this. So, and we'll get to that in just a moment, but for the audience to understand a couple of things, all pain happens in the brain. Let me clarify that. If I smash my finger with a hammer, what happens is when I smash my finger, my finger sends a message to my brain. Hey, what's going on here? I just got smashed with this big heavy object. It sends a message up my arm via a nerve. That nerve goes into my spinal cord, spinal nerve, and it goes up into my brain, spinal cord into my brain. My brain goes, yeah, man, shouldn't have done that. You just smashed your finger. You got a problem now. I'm going to send you back a message. Hopefully it's loud and clear enough that you never do that one again, because that's not good for your finger. Simultaneously, by setting off the alarm, I'm going to instantaneously elicit an inflammatory response. Most people think inflammation is bad, but the truth is we heal via inflammation. It's inflammatory modulation, meaning monitoring how much we have. So in that pain response, instantly my finger swells up. The capillaries all group up in that area because the blood is what's carrying the nutrients, the oxygens, the hormones, all the vitamins it needs to immediately start to coagulate, stop the bleeding, and start to repair the tissue. But all of that happens in the brain. Now, there's this interesting thing that happens, and this will be part of our remedies tonight. If I do an example like that, often when we hurt ourselves, we stub a toe, we smash our finger, we hurt something, it is very common that the natural next step is to shake it, to move it. Oh my goodness. Like and you keep moving, you smash your foot and you're like bouncing around the room. Rarely do you just sit there and stare at it. And the reason being for that is that there's this little sensor in your brain. It's called your pain gate. We all learn this. Yeah, all doctors learn all of this neurology way back in school. Medical doctors, chiropractors, physical therapists, all of us learn this concept. And what it says, what we understand with the neurology is this: there's a little pain gate in your brain, like a sensor. And when you move, and you're moving, especially your spine, because there's so much nerve input that comes from, as you move, your body must know where you are in space. It must have this thing called proprioception. So as you move, it opens up the pleasure gate and it closes the pain gate. So you intuitively, naturally will go into movement. You burn your finger. You don't, I promise you this, you burn your finger. You do not sit there and stare at it. You shake it. You don't want to stop moving because that gives you relief. You don't know why you're doing it. You've never had that neurology class. You're just doing it because you're a smart human being. And that's what we should do. If we have all our senses intact and we're listening to our body, movement becomes one of the most significant medicines for pain.
It's so intuitive that it's like hard to realize that it happens. Like the that natural inclination to just like flap a little bit when something happens. Even when you like take a spill, you want to just kind of like quickly get up and like redo yourself, right?
Yeah. Keep moving. You just keep moving. And we've heard that saying, if you don't move it, you lose it. You just got to keep moving. Just get up and get on the horse again, all those different things. And there is some real truth to all of those. Now that there is some gray area there. There's no doubt about that. And I should speak to that, I guess. And the gray area looks like this. When we start to apply the knucklehead syndrome complex into pain management. So let's just say my right knee hurts. Every time I put my foot on the ground, my right knee hurts even more. So you might say, well, I just heard Dr. Bart say that movement is actually a great form of medicine. So I'm going to keep moving it. Yet, if I keep doing that and I override this premise, this kind of like this truth that takes place, like my knee is damaged, maybe I twisted, I tore my ACL or something, and I keep moving it, and I'm overriding my intuitiveness. My intuitiveness, the one that we use to shake the hand, that innate wisdom, my innate is telling me, don't move the knee right now. That's because when I do that, then when I move the knee, it starts to hurt more. Maybe I'm damaging more. Now, all of a sudden, we're starting to move into a kind of a false action, a non-true action. And I'll explain that in just a moment here. Once we start to override it because we're thinking, and there's two ways that this is going to happen. I want everyone to listen to this. One, this is great for all my people who are kind of addicted to exercise, which exercise is absolutely amazing. And it is medicine, no doubt about it. And there's a way that we can even use it when we're injured. And I'll explain that. And then there's also the individual who has zero tolerance for pain. And I want to address both of these people right now. All right. So let's address the people who have the addiction to exercise. And I don't know that it's always the exercise, quite frankly. I think over my career, I would look at this and I would say that a lot of times I'll see people that won't slow down because if they slow down, they think they're going to gain weight, that they won't be sexy. And I mean that. I see a lot of that versus I'm going to keep moving because I know the neurology and I know that the way that the human body works and that through movement, I can close down the pain gate. I rarely see that, or that's the intuitive. I usually see another motivating factor that's built off a false premise. And this is really important to understand, because if my knee hurts and I have a false premise and I say, well, it hurts, but I'm going to ignore that and I keep moving it, I could create more damage. I definitely could. If I say, okay, my knee hurts, and when I use my knee right now, it makes it worse. So I listen to my body. Now I'm kind of walking in this little environment of I'm listening. So this is true. And then I take a true action, which might mean that I start to move my upper body. Because I can't move my knee, maybe I do my shoulders and my arms, but I still exercise. I still give my body the benefit, the natural medicine of movement, because even that movement, some is better than none. And it's off of this true foundation of there's nothing wrong with my shoulders. I can move them. The challenge I find with my folks who are addicted to exercise, they have their particular exercise in their brain that they need to do this, and anything less than that is not good enough. Telling in advance, let it go. Yeah, let it go. Now let me speak to the people who don't like pain at all. I will tell you this, you were given the gift of pleasure only via the route of pain. Okay. You don't really know what pleasure is unless you also know what pain is. And that sounds like, no, that's not true. As long as I don't have pain, I'll be happy. No, you don't really have happiness. You don't really have pleasure with your physical body unless you push it a little bit. You have to be able to experience both in order to kind of find that happy medium. And unfortunately, for the people that don't like pain, often they lean into more using pain medications that eliminate. Remember, we started this conversation by saying that pain isn't the problem, it's the symptom. So if we eliminate the pain 100%, listen, I don't like pain. Like, I don't like to be in pain long term, but I understand its values. That's why I'm going to give you tools tonight. No one likes pain, but it does help us grow. If you eliminate that pain like this, it didn't take much action, you didn't change your lifestyle, you didn't really have to do anything but swallow a couple pills with 3 ounces of water. And next thing you go, you didn't even do that. Someone just gave you a shot, and all of a sudden your pain goes away. What's the likelihood that you're going to stop doing what caused the pain? And the likelihood is nothing. You're not going to stop it. Most of the pain out there is now considered chronic pain, not acute, not trauma, not car accidents. So we're going to take the car accidents out for a second, the bicycle accidents, and even though our remedies are still going to work for those, but we're going to talk to what most people have is what's considered chronic pain. Arthritis, degenerative joint diseases, lack of range of motion, bad knees, bad hips, bad shoulders, all of that stuff that's been going on for any time more than a couple months. Those are all the chronic cases. And in those situations, if we're using pain modulators that are using drugs to ignore the symptom of pain, the signal that when I smash my finger, it sends a message to my brain, and my brain says, yeah, dude, don't smash your finger again. And now I block that message out so I can keep smashing my finger. Not a good outcome. Yeah, and I'm not likely, right? And I know, Whitney, that no one would smash their finger. Yeah. What would people continue to do? They would continue to sit in their desk for 6, 8, 10 hours a day without stretching. They would continue to eat foods that create high inflammation in their body without moving and without stretching, without getting their groove on. So there are a lot of things that start to happen that we wouldn't consider very intuitive, that we wouldn't consider very intelligent for that matter, that once we start taking pain medications, we change the whole game. Now we're sitting on an entire false foundation. So now everything I just said about movement, if you're on pain medications, no. This is a false premise now. We're not working from the same set of rules here. So the idea that I just said, movement is one of the best ways to reduce pain. If you take a pain reliever and then say, well, Dr. Bart said the best thing I should do is get back in the game. Nope. I said, what I'm really saying is that we have to be intuitive. We have to become better listeners. There was a conversation I had so many times. I have that conversation almost every time in our office. Once people get through pain, they'll often come, one of the visits, they'll eventually say, Doc, what do I need to do to make sure this never happens again? And almost always I'll tell them, this is going to surprise you, Whitney. What is it, Doc? You're going to have to become a better listener. Yeah. And that's all of us, right? So your body, so think how many times we've sat at our desk and our necks are tight and we don't get out of our chairs.
What? Who does that, Bart?
Right. Why would we do that? That would interrupt the pattern, the rhythm, right? The concentration, the focus, which the science has actually proved otherwise. When you do take a break, you actually come back in with more focus. So,
do people ever ask you, Bart, about like when they are having some discomfort in their body and they're like eager to get back to like a sport or an activity? Do you ever like get asked what sort of time frame that is?
Yeah, I get it. I always, and I understand it because it's where our brain wants to go. Doc, when I can get back in the game, or when can I go golfing? When I can go play tennis again? It's a good time. So as you can imagine, what I always do is I put it back in their court. I'll say, you're going to know that better than I will and sooner than I will. And they're like, oh, and I understand. And being respectful, then I give them a simple answer to this. And I will typically say, if you drop your keys on the ground right now, Do you have to think about picking them up, or is it a no-brainer? You just bend down and pick them up. And if you have to think about, or you have to modify, or you have to kind of cheat how you normally would go pick them up, then you're not ready for tennis. You're not ready for golf. You're not ready for whatever game it is, because your normal instinctive movements to do a fundamental action like picking up a set of keys off the ground, you're incapable of doing that without a series of thoughts of how to get there. And in sports, you don't get that luxury. You know, if you got a golf club in your hand, you pull it back, you rip and you swing, like that happens. And so you don't get an opportunity to make modifications along the way. So that's where the patience, the self-love, the self-respect, and maybe a little bit of humbleness along the way of knowing this too will pass. And if I give myself the proper opportunity, I could probably learn something from this and come out of this better. And that would always be the goal, is to literally come out of whatever said pain. I don't care if this is a migraine headache, neck pain, jaw pain, whatever it may be. The goal is that you learn a little something from it and you come out of it better.
I am not sure what your path was when you were 19, Bart, but I imagine you may feel that way about that journey that you went through with the pain, because here you are, a chiropractor.
Yeah, absolutely. And that was the deciding, that was the definitive act. What happens? I had an injury that we took the normal medical route, and I've talked about it here on the show before. My mom brought me to the best doctor she knew, and they basically all said, here, take these pain meds, these muscle relaxers, pain relievers. No longer play your sports, no contact sports, no squatting. Definitely, I had a disc issue, so they didn't want me to, when weightlifting, they didn't want me to squat or anything. And my mom decided to try something different. And it was outside of my box because I'd never actually been to a chiropractor before. I never really knew what they did. I'd only knew that chiropractors were called quacks. That's all I knew about chiropractors back in the day. Yet, fortunately, I had an incredible chiropractor up in Connecticut. And he basically said, take better care of your body. And your body's a self-healing machine. And as long as you give the proper amount of time and rest and exercise and nutrition, I wasn't listening. I was not listening, I promise you. All I heard him say, that your body can heal. That's all I heard. My next question, to your point, Doc, when do you think I'll be able to play rugby again?
Yes.
And I remember him said, we'll see. And that to me meant, if I'm tough enough, that's fast. That's what it meant to me. So in 2 weeks, I was back on a rugby field. And fascinating enough, I couldn't do some fundamental action, so it wasn't the right thing. I couldn't do what's called scooping a ball, like running full steam and then picking a ball up while I'm in running motion. I couldn't do it. I couldn't bend over to touch my toes.
You could not pick up your keys, as it were.
Could not pick up my keys, correct. I would have to bend down, squat down to one knee, bend over to the side, pick it up. And yet I was on the rugby field. And so that was a live and learn, because then I just ended up back in his office in acute pain. This time less fearful because I'd managed through it. So I was like, oh, I know what to do now. I'm going to go over there to see Dr. Lane. That was his name, Roger Lane, up in Connecticut. And I would go to his office and he'd be like, heard yourself playing rugby? And I'd be, yep. And I'd lie down at his table and he'd do his thing. And I'd see him for a couple of visits, and out the door I'd go, and he'd be like, you should probably keep coming in. I'd be like, gotcha, Doc, see ya. And, so I would stop coming as soon as I felt better. And this took place over a couple of years, probably 3 years. And I was living and learning as I go. I was, man, I should probably take better care of myself. I mean, he said the same things all the time. You should probably incorporate a little water. That was my big thing. I was always dehydrated. So let's do this way. Let's jump into, because pain gave me one of the best things that ever happened in my life. I can promise you that. And there's a lot of things, a lot of different ways we experience pain. We can have loss, and that can give us, and that's a challenging one, but it can give us a gift. We can have physical pain. We can have trauma, and maybe you had nothing to do with it. I would say that the rugby thing was kind of my fault. I chose to go on a rugby field, right? I didn't choose to get hit that hard, but I chose to go on the rugby field. Sometimes you get in a car accident. Maybe it's not your choice. Maybe, literally accidents happen. But either way, what we do next can really shape our future. So I want to go through a couple of things, and we'll roll through these quick because they're really easy. And we've definitely talked about them all here on our show. So first and foremost, let's talk nutrition when it relates to pain. Huge, folks. it still gets under my skin when a patient comes in, they say, "Oh, doc," and all my patients know, I at least hope they feel this way. They feel comfortable being like, "Yeah, doc, I got blankety blank medications. I got these, 800 milligram aspirins, or the doc gave me a Percocet, whatever." Oftentimes my people tell me these things because they know I'm not going to judge them. But what I will ask is, did they tell you to do any diet modifications along taking that pain medications? Did they tell you to do any rest? Did they talk to you about when you should or should not move when you're on medications? And 99% of the time, it's no. And I want to start first with diet and tell everyone this, especially with chronic pain, folks. 50% or more of your pain is because of your diet. You can manage this. You can improve it. How do I know? Because I've been doing this for a long period of time. Carbohydrates, sugar, alcohol will all enhance pain. And the bummer is, often when we're not feeling good, what do we lean to?
Yeah, it really sounds like what we go to when you kind of tuck yourself in bed and get yourself, I don't know, like a Sprite and some like crackers, and don't really move very much and kind of watch
Bowl
some
of ice cream.
I don't know.
Yeah. So it's these conversations right now that prepare us down the road, because when you have your chronic pain turn into what you think is acute pain, what does that look like? You wake up and all of a sudden you have a neck kink, folks. You think that happened overnight, and that was the last thing that happened after months. That back pain. I can't tell you how many people, Whitney, that literally have been brushing their teeth and they think they feel like they blow out a disc. Those are all chronic situations. So the day-to-day pain that you have that just hurts when you get up in the morning, to bending over, or your knees hurt a little bit. The impact on diet, I have talked about it for hours here on this show, and I'll encourage you to go back and listen to all of those. But how do we sum that up? You got to get away from all the inflammatory foods, the glutens, the breads, the pastas, the sugars, the carbohydrates, folks. That's what we got to avoid. The bad seed oils that don't allow the nutrients to get back out to the joints. Make sure you're staying good and hydrated. God's garden. If it comes from a root plant tree, walks in the garden, swims in the sea, eat it. If it doesn't, don't. And having massive discipline and preparation when you're in pain, knowing that those things prolong your pain. So if you want to be in pain longer, have a couple beers and a pizza when your knee hurts. That's it. It's as real as it gets. All right. So that's number one. And I think we've probably beat that down. Well, not beat that down. I think I can continue to say, and probably should continue to say, that over next umpteen years. So I want
never not relevant, Bart. I'm glad that you continue to say it, honestly.
Yeah. And that's a good point, because it becomes relevant when you have the pain. And every year, like in January, when we run the cleanse, what is one of the biggest symptoms that people say, my victory was this, my aha moment was this, is that I don't have nearly the amount of pain that I had 3 weeks ago.
Truth, Bart. We hear it every year.
We hear it every year. You guys just ran a mini cleanse and you hear it again. Anytime we modify the diet that helps us get rid of the bad guys, we win. And I love watching people become pain-free. And if you've ever done it in your life, you've had a period of time in your life where you've had a lot of pain or consistent pain, and all of a sudden the pain goes away. If you feel it feels, hopefully you're grateful enough, and it feels like you have a new lease on life. I know for me, especially with what I put my body through over the years, nothing would probably be more emotionally painful to me than to lose the ability to use my body.
Yes.
So when my body feels good, I'm very, very grateful for it. And I want to feed that fire. And trust me, when I'm not feeling so good, I understand the draw, the addiction almost to wanting some sugary food that makes me emotionally feel good for a moment. I get it.
It is so momentary too, like so momentary.
Very, so momentary. It is. And then the moment that goes away, you get another choice to make. And now you've already kind of slipped a little bit. So it might get easier to slip. All right. So let's all agree that nutrition is a huge part of it. What do? Just remove everything that doesn't come from God's garden, period. All right. Now let's go to number 2. Let's talk about herbs. So herbs have been used medicinally for thousands of years. And I want to introduce a couple herbs, and I'll introduce a couple like vitamins and other nutrients to be good. So there's 3 specific ones I want to talk about. 1, turmeric. Especially, there's different types. We use one called turmeric forte. It is bound to fenugreek, and which basically allows it to get into your cells, your tissues, even the blood-brain barrier, to so much easier than any other type of turmeric. And the literature on this on the benefits of turmeric for pain modulation is through the roof. We're seeing more and more doctors at least saying, yeah, that's probably pretty good. And it's absolutely effective. Now, here's the thing, folks. If you're outside playing football, you're a football player, or maybe you're a silly knucklehead and you kickbox and you hurt your knee and you take some turmeric, is it going to make it so you can kickbox again in 2 days? No. Is it going to help your body recover, produce the proper amount of inflammation, modulate what inflammation shouldn't be there, and help your body stay healthy as you go through the healing process? And the answer is yes.
And tell me if I'm wrong, Bart, but enjoying turmeric on like a daily basis, there aren't really any negative side effects, right?
Yeah, and that's the beauty. Again, let's not discount this kind of conversation as well. Are there negative side effects of medications? There absolutely is. Are there negative side effects of herbs? Hard pressed to really find any sustainable negative impacts of an herb. And usually if it is, it might be that I would have to guess at what those could be, other than maybe sometimes you have a stomach. I don't even know. I'll just be making them up. Anyways, the herbs, and then so the turmeric, absolutely fantastic. And you could take it daily as kind of prohibiting discomforts in the inflammatory process that might be taking place in your body. So that's a good one you can take on a daily basis. And in the event that you have like more of an acute injury, you tweak something in soccer practice, your neck's hurting you at the end of the day, sitting on your computer, a long drive, you can load up. So you can increase your dosing along with the increased amount of discomfort that you have in the body. The other two I want to talk about, probably less popular, yet we use those. We use the next two in clinic a lot. They're very therapeutic. One is called Salagesic. And anyone who understands Salagesic or Salagesic or has ever worked with herbs before knows that this comes from something called willow bark. And yes, it's a tree bark. This is what they actually use to come up with the formula for aspirin. Now, you can't patent willow bark and you can't patent Salagesic. So they tweak it a little bit and then they come up with aspirin. So the beauty is here with willow bark or Salagesic, that's what we use in our office. Fantastic for pain relief, low back pain, achy, sore. Sometimes people that have a little bit like sciatic pain, neck pain, tight shoulders, especially like that neck pain that builds up after a long day sitting at your computer. Maybe there's a little bit of stress, maybe you're a little dehydrated, that tension that builds up in the body. A couple Salagesic before you go to bed to help modulate some of those pain receptors. Fantastic, simple, gentle. And even though I mentioned that it's willow bark, and that's where they essentially derived aspirin, it won't have the negative impact like aspirin does.
Can I also give like a shout out to Salagesic for menstrual cramps? Because it is magical and I've tried lots of things and this is it.
Yeah, so that's a great example. So cramping, muscle spasms, doesn't matter where they are in your body, whether they're in your traps or on your neck or in your uterus or in your body or in your abdomen area. Phenomenal. Salagesic is absolutely wonderful. And the beauty is it's one of the things that, just like you might have a Tylenol or aspirin in your medicine cabinet, having Salagesic there when you need it is when you need it. And then when you don't need it, you don't got to take it. A little bit different than turmeric. Turmeric is a supplement that I often recommend as a low dose daily, where Salagesic say, no, just put the cap back on. And then when you have any discomforts, bring it back into your life. The next one I use equally as much, and especially if you're having nerve pain. And how do you know? Most nerve pain, so cramping can be nerve pain, but when I'm talking about radiating nerve pain, sciatic, numbness and tingling down the arm, the type of pain that is keeping you up at night because you fall asleep on your right side and it goes numb and tingling, that type of pain, that nerve pain, we use something called Nervagesic for. And the name isn't as important as the three herbs I'll describe real quickly. So one of them is California poppy herb, which it's a bit sedative, which is fantastic. And it's a pain modulator. So it calms the body down. And this is important when it comes to modulation. So we're not trying to tell the pain to go away. We want it to go away, but we don't want to refuse the innate wisdom of the body. So what we get to do when we use something that has that calming effect, like California poppy herb, it basically calms the central nervous system down. So we're not as heightened in a stress state, increasing the amount of stress in the body. So a tighter body is in less flow. Earlier in this conversation, I talked about movement closes down the pain gate. Inactivity and tightness increases it. So if you have something that chills you out a little bit, California poppy herb is a phenomenal herb for that, and it helps regulate pain. Then in that same complex, it's nervogesic. It has California poppy herb. It has an herb called cordialis. Cordialis has been used in traditional Chinese medicine, TCM, for thousands of years. It's just great for pain modulation, downregulate pain, help the central nervous system. And then last but not least is Jamaica dogwood. Very similar to California poppy herb. There's no opioids in it or anything like that. So again, helps relax the central nervous system, which is a big part of pain, and then also helps downregulate the pain receptors. So that one right there, nervogesic, salagesic, and turmeric are probably my top 3 herbs that I use in our clinic every single week. They're absolutely fantastic. And same thing with the nervogesic. If you're not having pain, you put the cap on, leave it in your cabinet. And if in the event that you have some more pain, come back to it. And especially folks, maybe if there's a difference there between the salagesic and the nervogesic, the nervogesic probably more associated if you have nerve or radiated pain, but the salagesic will work. No, absolutely no doubt, because of its impact on releasing spasm muscles. But really, probably the biggest difference, if the pain is keeping you up at night, the nervogesic, because of the California poppy and because of the Jamaica dogwood, they will have more impact on helping you sleep at night. They have more of a calming effect.
And taking these herbs, Bart, so this would move us towards like a true action, correct? This is not setting up for like a false premise.
No, absolutely not. So we're still 100%, Whitney, honoring what the body is doing. So the goal here is that we are going to use as many of these tools. I'm going to give you 4 tools. One, we just talked about nutrition. And so these are ands. These are not like, well, I tried this one, then I'll try the next one. As many of these and as quick as you can incorporate all 4 of these, that's the ticket. And that is how we practice part of our health, because along with our health is going to come days that aren't so hot. So when I still beat my body up, and I'm practicing jujitsu, I'm sparring on the weekends, and I'll be in a fair amount of discomfort. We'll just call it pain, right? And I'll use salagesic and nervogesic, and the others that I'll use in here, and I'll use turmeric. I'll use them all together, and I use my omega-3s. Really important to have a high level of omega-3s. One of my favorites, most likely, that I'll recommend is cod liver oil. Those, again, will help facilitate the inflammatory process, so it's not too high, not too low, which is pretty cool. Magnesium, especially if I've overworked, sweat a lot, and I find my body chronically tight. You can throw in a little magnesium there to help loosen that body. And then last but not least, if you find yourself with chronic pain, do some of the things we're talking about, the nutrition and whatnot. You can start taking collagen every day. It's not necessarily going to help you with your acute pain, the pain you're in today, but in the big picture of things, collagen is always part of anything that you feel in your musculoskeletal system. And if your collagen is starting to break down easily, you're getting little muscle pulls and muscle tears, then we need to support that collagen system. So taking a little collagen every day could be beneficial as well.
And Bart, before you offer us the other 2 kind of remedies when we're in a pain state, can I just ask, like, if someone were interested in getting kind of their own personalized protocol for these supplements, or maybe in tandem with some other things going on, are you available to kind of work with someone one-on-one?
100%. And oftentimes that is necessary, because I think if we are able to navigate through, especially if you're dealing with chronic pain, maybe it's arthritis for you, maybe it's coming from a certain part of your body and you don't know how or why. Sometimes navigating to figure out kind of the root cause of your pain, especially when we get to number 4 here, becomes huge. And then developing strategies and put them in place. So I certainly recommend, if you've dealt with chronic pain and you feel like you've done a little bit of everything, maybe that's a perfect example. And yes, they can call our office. We do Zooms just like you and I are doing right now, and people could live anywhere, anytime, not anytime, but anywhere they live. We certainly can accommodate that.
Awesome.
All right, so let me move on to number 3. And this is where I think this is probably the most missed in all 4 of these categories here. And that's the therapies. They do take action steps, and these are time-tested, proven. Most of these have been around for long periods of time. The science behind them is amazing. Most important, the results are amazing. And again, They're very, very low risk, meaning that you're not having these big side effects. They're thousands and millions of people have used them all. And number one, I'm going to say is chiropractic. If you have spinal pain, folks, go see your chiropractor. Yes, go see your chiropractor. No matter what technique they utilize, all of us, different techniques, different ways that we go about things, but all of us do really one thing. The one main goal is to take pressure off of your central nervous system, to align your spine and make it move better. And when we deliver an adjustment, whether through an instrument or through hands, or we move you around, you hear the popping noise, you are moving a spinal vertebrae, you're moving the vertebrae. So earlier when I talked about movement, if your spine gets locked down, that right there, that momentary moment will increase the amount of that pain gate opening. The pain receptors are going to shoot through the roof. If you get that joint moving again, proper mobility back into that joint with alignment, the alignment part is key here. So I'm not telling you just go out, run harder. Most likely you have spinal pain because you had misalignments. So go to your chiropractor, get adjustment. So oftentimes and it's 100% honoring your body in the sense that we're not working off a false premise. We're not trying to override the pain receptors. We're actually getting to the root cause. I would say 99% of spinal discomforts, and we'll take traumas out, are because of misalignments, including sitting. Sitting is a misalignment. It's poor posture. Our shoulders are rolling forward. Our heads are coming forward. We have tilts to one side, tilt to the other side. These misalignments are downregulating the function of the human body, making the muscles around the spine tight. The nerves are getting compressed. That sends a message up into the brain. The body goes, nah. You can't compress that. It's a spinal nerve. I need those nerves to go out to your gallbladder. I need them to go out to your intestines. I need them to go out to your uterus, your ovaries, your testes. And if you keep compressing those organs aren't going to work properly. So your body sends a message back with pain. And if you don't listen to it, and what will often be needed is some better alignment, maybe need some stretching. And this is why things like chiropractic and acupuncture, chiropractic and physical therapy and stretching has always been so effective. But they do require a little time, a little action to be taken. That would put that on top of the list if you have any spinal discomfort, spinal pain. And am I a little biased because I'm a chiropractor? Yeah. But if we get to the premise of why I'm a chiropractor, it wasn't because I thought chiropractic was great and then I went out to prove it. I literally was a chiropractic patient before I was a chiropractor. And you'll find if you ever ask your chiropractor, say, I'm not your chiropractor, and you ask a chiropractor, how did you become a chiropractor? I will guarantee you that he or she will tell you, I once had an injury that nothing else could solve. And I went to my chiropractor and I got better. It'll sound something very similar to that. Beautiful. All right. Yeah. So chiropractic, the beauty is it is increasing the movement in the moment and most likely in the very joints that are creating the pain that are locked down. All right. So that's number one. Number two is let's talk about acupuncture for a moment. Acupuncture works in a little bit different way. And I'm going to get into a little bit of the science of why, and so people understand this. So some people think, well, how does acupuncture, sticking needles in me, help? So for many years, for most of the years, most of us have been alive, the acupuncture really wasn't accepted mainstream. It's considered this weird alternative, even though it is the oldest form or source of medicine in the world. It's the longest practice source. Even though it was that, it didn't have the science. It had the history. And then somewhere, I'm going to just roughly say about 20 years ago, they did a deep dive in trying to understand what the heck was happening. How were acupuncturists getting such incredible results using these meridians, sticking these needles in people, and all of a sudden they were healing up things. Gallbladders were getting better, energy was better, hearts were balancing out, the women were getting pregnant. What was going on? Like what was going on here? And what they deducted after they started to watch what took place when you stuck a needle into a trigger point or into, let's just say, for the audience here, we'll say like into a muscle spasm. Well, they were able to observe what that was going on the inside. And what they observed is that it was increasing what's called fibroblastic activity, fibroblasts. Blast means to build, which means that when those needles were going to those trigger points, it was increasing the speed of healing momentarily. And here's interesting how this really takes place, if this doesn't confuse you. The reason it was working, it instantly created an inflammatory state. It instantly created a small cytokine storm And your body then uses that inflammation to signal for healing. I say that because many of you have tennis elbow and you have golfer's elbow, whatever they are. You have shoulder pains and you go to the doctor and they give you a massive anti-inflammatory. You say, well, I didn't take a pain reliever. I just got a steroid shot. And when you take that anti-inflammatory, also know you could call it an anti-healing shot as well. It really is. It shuts down your immune system. So now there's not a brain-body connection there. And as a result of it, your body's not going to send it nutrients. It's not going to send it more oxygen. It's not going to send it new red blood cells because it doesn't know, because you shut down the inflammatory response. So the too much inflammation, not so good. The right amount of inflammation, the one that your body's innately producing, and we are supporting that mechanism. We are supporting it by using things like turmeric so we can facilitate the inflammatory process. We're using things like omega-3 so we can facilitate the inflammatory process. But by shutting it down, by taking a steroid, you're literally shutting down the innate wisdom of the body. So, all right, we covered chiropractic, acupuncture, phenomenal, increased new cells on the spot, which is pretty cool. And
yes,
then,
are you an acupuncturist?
yes, I am an acupuncturist, by the
Cool.
way. Yes. So that was part of my journey. And really how that happened was when I first started getting involved with mixed martial arts, no surprise, but I hurt my shoulder pretty bad. And I had done that back in rugby, and I ended up with shoulder surgery way back in the day. But my shoulder never really healed because I didn't really rehab it, quite frankly. I didn't get the range of motion back and do all those things. So I really had some challenges with my shoulder. And one of my guys, my jiu-jitsu buddies, said, you should go see my acupuncturist. And being a chiropractor, I was like, well, what are they going to do that I can't already do? So I eventually was open to it because pain will really open up your mind to whatever possibilities are available. So I go there, and I still remember this. And it was a young lady, I'm saying 40, whatever. And she didn't speak a lick of English. Not that I understood, put it that way. It's not that I understood. And she told me some fascinating things. She said, oh, yes, you've blocked chi, she told me. And she told me I was too angry, which you can imagine made me more angry.
Yeah. Did you listen, Bart?
Yeah. So, and no, not in the moment I didn't listen. I got mad at her. Yeah. I got more angry. So, but it wasn't the first time in my life that I'd heard that. And sometimes you got to kind of hear those things. And that was a real blockage for my healing. So I didn't have the tools, quite frankly, in that moment to deal with that. Yet it was put in the bank. I promise you that. It was put in the wind. You mean I'm angry? I'm not angry. Fuck her, whatever. Right. So that's kind of what was my response in the time. So I didn't have the tools. And yet over the years, as I then start to reflect on that, after that, I started to realize, wow, what an incredible tool. If I could have that in my tool belt, I wonder how many more people I could help. That maybe chiropractic wasn't the only thing that I could offer them. What if I could offer them some acupuncture? So I went back to school, and I then became an acupuncturist, and it opened my eyes to, wow, this is fascinating. And I'm getting a little derailed here, but it's absolutely fascinating. But it's going to tie into the next couple of things I'm talking about anyway. So, so acupuncture opened up my eyes to a whole nother level of healing, because as a chiropractor, you have to be a little bit of a built-in scientist as well, because your depth of understanding anatomy and physiology, or what we call the triune of health, the mind, the body, the science, all of those things, the philosophy of health, you have to really pull those together in order to understand the uniqueness of each individual human. So science by itself does not understand the uniqueness of a human being. But when you start to understand the way that the mind works, you can start to appreciate the body, meaning the physical components that we have, the organs, the tissues, the glands, the nervous system, the musculoskeletal system, the cardiovascular system, and then applying, I know it sounds a little complicated, a philosophy. The philosophy meaning, who is in charge here? Who's the true boss? Who's the smartest guy in the group? And the chiropractic philosophy is that the power that made the body heals the body, that we are the facilitators of that healing, we're using whatever modality we may have. And most of the time it was the chiropractic adjustment. That's different than the traditional medical philosophy that we see now. That philosophy is that the doctor is the smartest and they will dictate what the body does. For example, maybe use a steroid shot and shut off the innate wisdom that's communicating the mind to body so it doesn't have inflammation. So it pleases the moment, punishes the future. Wow, I just went on a rant there, didn't I?
Yeah, but the zinger at the end was real, Bart.
Okay. Yeah, I just went on a little rant. Anyways, all right. Let me pull it back in here together. So chiropractic, acupuncture, another one phenomenal. We've talked a little bit about this and probably new to everyone is sound wave therapy. Sound wave therapy is something that I'm so excited to be able to offer our clients. And I love the fact that it's in pretty much every city at this point. Sometimes you'll hear it called sound wave therapy. Sometimes it'll be called soft wave therapy or shock wave therapy. We don't like to call it shock wave therapy because it sounds scary, but I will tell you this therapy is fantastic. It is, and it's kind of, it's very gentle, very safe, very safe. It's considered a class 1 medical device, which is the same as a Band-Aid. And the results we're getting with connective tissue disorders, with neuropathies, with tennis elbows, with Achilles tendon issues, with plantar fasciitis, with shoulder issues, frozen shoulder issues, you name it, the list goes, arthritis in the wrists and the hands, old surgeries you had 15 years ago that have scar tissue around them, the results we're getting absolutely phenomenal. So knowing that there's availability and possibilities is one of the reasons we're doing this show tonight for pain management. Remember, all 3, now we're going into number 4, all 4 of these. The goal will be that you apply all 4 of these. And number 4 is your mindset. So our mindset holds a key for a lot of the comfort or discomfort we're going to have in our life. And I brushed on a little bit earlier. If we are angry, and sometimes we're angry because we're hurt, right? I know a lot of people that they're angry, so they're not really nice when they're hurt because now that pain inhibits the quality of their life and they're upset. And sometimes it comes out as anger, sometimes it comes out as fear, sometimes it comes as sorrow. Yet, in the event that we have any one of those, fear or anger or sorrow, all of those kind of are a derivative, a little bit of a fear type emotion. And what happens in that, it's very stagnant. In Chinese medicine, we call it, blocked qi. In real life, we just call it tightness in the body. So those emotions will enhance the amount of pain that your body's experiencing. So to say the simplest things, and you don't even have to dive any deeper than what I'm about to share with you now, just saying these words out loud or writing them down on a piece of paper, and then you could toss a piece of paper out. You don't have to diary all this. You don't have to do anything. All you need to do is say these words. This too will pass. The moment you say that, your words or your handwriting, your body takes it down a notch. And the more you keep doing it, with each and every little pain signal, this too will pass. I know this will pass. It's passed in the past. And the moment you do that, we start to deflate the energy that pain is having upon our body. So what I'll see, Whitney, over years, or every day when I walk in the clinic, if someone comes in acute pain, you see it in their posture. It doesn't take a chiropractor to see it. Am I correct? You can see someone 15 feet away that you've never met in your life, and you can tell they're in pain. And it's because of the rigidity that they hold in their body. Now let's just for a moment back it up a little bit. Let's just say they're in 10 out of 10. You see them across the restaurant and they're just in pain. You can see it in their body. They're very rigid. They are not moving flow. They're not on the dance floor. They're rigid. Now let's make it a 9 out of 10. They still look about the same. 8 out of 10, about the same. 7 out of 10. But let's wiggle that all the way down where they're just holding it and it's a 3 or 4 out of 10. Could you still notice it? Or does it just show up in the shoulders that are rolled forward? Does it just show up in the expression on their face? Does it show up in the tightness in their body? So I'll tell you right now, if we can loosen up our minds a little bit and literally flow, I'm going to say some silly things, but I think a lot of our audience is going to understand this. There's a medicine in movement. There's a greater medicine in dance and wiggling our body in weird ways that lets go of a lot of that discomfort. We do some weird things in our yoga school, right? And what's always fascinating is my wife will bring a lot of people through these, like when everyone's really uncomfortable, they don't want to do it. She'll bring them into these dance sessions and it's very uncomfortable. I hate them. I try to make sure I'm not there when they're happening because we wiggle around and dance and everything. But the truth is when you're done, you feel good.
Yeah, you feel better. And I've been in those dance rooms, Bart,
Yeah.
and the discomfort becomes comfortable by the end. It's weird how it happens.
Yeah.
And it's also some of my favorite moments there.
Yeah. And so that ability to flow, that uninhibited flow, would be no different than going out and running on the beach for a little bit, chasing after some things. It would be a beautiful flow that you have in yoga that's just kind of, posture after posture linked together. All of those things are there for a reason. We see so many of those modalities, the martial arts, like when we think of Tai Chi, it's a constant state of flow. There's no stagnant moment. And we think, well, where do they come from? Those are about making the body feel good. And a lot of it is releasing the tension that we're creating through our mindset. So although I didn't like to hear that I was angry, and that was one of the reasons I was manifesting pain in my life, it was so true. I was so rigid. I was so tight in my body. I was so unlimber physically, rigid mind, rigid body. Literally, I can remember times training with my wife's Olympic team, and they were laughing at me because how tight I was. I had muscles everywhere, but they were laughing at me how rigid I was. And I know that, and I can say that now because I know I don't carry any fraction of the anger that I used to have in my life. I don't know why I was there, but it was just there. And then I heard it again a little bit later in my life from someone I really kind of like looked up to, and they were like, "Yeah, you're angry, dude." And I'm like, "Oh shit, here we go again."
But it's a good point, Bart, because like you don't have to necessarily know exactly where it comes from in order to release it.
It's not important at all. Not at all. It's just having a little bit of awareness and then knowing where we want to go. Well, it's the opposite of angry, being happy, like free flowing, like letting it loose, let go of things. And then when I started to dive deeper into traditional Chinese medicine, I realized that I could just use phrases. And that's what I'll share with a lot of people. We'll talk about it here at times, that we can just say things and let it go. I don't have to come to the end of that conversation and dive much deeper in that. I can literally just say things like, what do I need to let go? I'd say that for years. And every time I say it, things would just let go out of my body because my subconscious mind immediately engages in that action. If I ask it, it's a true question. So my body's not going to defend it. It's going to go, all right, here's what we need to let go. Bye-bye. So if we allow ourselves to just kind of have that self-dialogue, man, the healing is so much within that. And I share it this way because instead of just saying, oh, you just got to have the right mindset, knowing that each one of us has such an ability. And when you start to bring all four of these together, you start to clean up your nutrition. You use the right tools, like the right herbs, a little salagesic, maybe some turmeric, maybe some California poppy. You bring those into your body. You start to get your spine to move better because that's the highway of the nervous system telling your brain what's going on in your life. So maybe we get that moving a little better. Maybe we get a little better aligned. Maybe we bring a little dance, a little yoga into our life. Maybe you get some acupuncture, some sound wave therapy to break up some of those adhesions that don't let you move. Those frozen shoulders, the scar tissue in your knee, you get those things. And then taking some accountability and just ask yourself some good questions. Let yourself know. Take yourself off the hook and say, this too will pass. What do I need to let go along the way? What's my next best move? And when we just start to ask those questions of ourselves versus the flip side, which is real, is the repetitive one. What's wrong with me? How long is this going to last? What if this gets worse? And that's what happens with pain. But if we have what we shared tonight, we have a little bit of an outline, a little bit of a playbook, a little bit of a strategy that when we do get faced, we're like, all right, I know what I'm going to do here. I got these 4 things I can dive into deep. And before I know it, this too will pass.
Everyone, thank you so much for joining us tonight for the Health Made Simple show.
Thank you, everyone. Keep doing the thing. Keep sharing it out. Keep spreading love. If you get an opportunity to give us a good rating, we'd love that. Appreciate that. And of course, we're going to continue to take deliberate action for the mind, the body, overall wellness. Y'all be awesome.